Hey friends, Dr. Christy here, and I just wanted to come on for a minute and talk about hemoglobin A1C. Very common lab value used to evaluate blood sugar management if and where you are on that spectrum towards totally healthy normal blood sugar metabolism all the way to full-blown pre-diabetes and type 2 diabetes. So first and foremost, I just wanted to mention where that cutoff is depends on who you ask. Personally, for me, I like your hemoglobin A1C number, that A1C, to be under 5.4. 5.4 and under is the ideal for me. Some people might say that's a little bit extreme, but if we're really focusing on ideal, optimal blood sugar management, that's the numbers that I like to see. Some people even say even lower than that, but to me, that's a good, reasonable, realistic expectation for people in this day and age. Anything between 5.5 and 5.7 is okay. This is very early. All we need to do is really just focus on a couple key little things here and get it reversed. Anything 5.8 and over is definitely in what I call kind of danger territory, especially over 6. Then to me, you're basically you're essentially close enough to type 2 diabetes that we're working with you as if you are. Now, granted, I've seen patients in the upwards of 7, 8, even 10.0 A1C levels. That's where it's really uncontrolled, and there's a lot more things that we need to take into consideration. However, as a part of this video, what I wanted to mention is that there are 4 main things that I find that contribute to an elevated A1C. Yes, this is a blood sugar marker, but it's not just about diet alone. So, number 1 is, of course, diet. So we'll start there because it's the most obvious. When you have an elevated A1C, it definitely means you're not metabolizing your sugar properly. So that could specifically be you're eating too much sugar in the form of refined carbohydrates, in the form of actual sugar. Something in your diet might not be right. So it'd be important to evaluate that with either a holistic provider, nutritionist, something of that nature. Number 2 is not enough sleep or poor quality sleep. I've mentioned on previous videos, I did a little experiment on myself many years ago. This is kind of what I do for fun from time to time. I check my blood sugar before and after meals to see how my body responds to different types of foods. And you can find when you do this, just like the continuous glucose monitors, you can find how your body responds to different things. And during this time, at one point, I discovered how poorly my body responds to lack of sleep. For a night or two, I basically got very, very little sleep, and my blood sugar markers were basically close to diabetic range. And I've never been close to diabetic in my life. My A1C has always been very, very low and optimal. But this was the first time that my fasting sugar did not reflect that at all, and it was all due to lack of sleep. So poor sleep, either quantity or quality long-term, can absolutely impact your blood sugar. Number 3 is inappropriate exercise. So if we talk about exercise, we want to be sure that it's becoming a stress reducer to your body, not a stress creator. And if you're exercising inappropriately, primarily high intensity interval training, or really just high intensity spiking your heart rate way too high beyond your aerobic capacity, that can mess up your blood sugar. I see it from time and time again when people are eating really well, they're sleeping really well, they don't have a lot of stress in their life, but exercise, they're pushing themselves far, far, far beyond where their body should be capable of holding. So take a look at your exercise routine and make sure that that is optimal for you and your body and your stage of life. And last, but definitely not least, is stress. Stress comes in many forms, but stress impacts your body on a deep level. It causes mobilization of the hormone cortisol. Cortisol gets a bad rap, however, it is necessary in the body. In acute crisis, it's anti-inflammatory, it takes care of good things, but it does mobilize blood sugar to fight, or flee an invader or a predator of some kind. So if you're mobilizing cortisol, you're mobilizing sugars, then you're going to end up having an elevated A1C level, especially once this trips into a long-term stress. We're talking emotional stressors. Pain is an incredible stress to the body. So in fact, it's actually one of the greatest stressors to the adrenal glands themselves. So if you have chronic pain, your A1C may be elevated simply because of long-term elevated cortisol. In addition to if you've got bugs, if you have chronic inflammation or chronic infections or something, stress is not just emotional, of course, it absolutely can be emotional stress too. So What of those 4 might be causing your A1C to be elevated? If you have an elevated A1C, evaluate those 4 areas of your life and see what could be lurking under the surface. It might not just be diet alone like you've been taught to believe. Questions, drop them below, and I'll talk to you soon.